and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency servicing Palm Beach County, Broward, and Miami-Dade. Our number is 954-717-7027. I am your host, Louise Gomez, and I am delighted to introduce everybody today to my co-host, Liz Watkins. Thanks for joining us today, Liz.
Thank you. I'm so excited to be here.
We're excited.
Thank you.
We are excited to have you. I know that you introduced me to our guest today that we're having, Dr. Conklu, and we've been talking about this for a while now, so I'm glad it all came together.
Yes, I did. We've been friends for 30 years, Dr. Conklu and I, and I'm just excited that he was available to be here.
Thank you. So we're going to be introducing Dr. Conklu. His name is Dr. Emre Conklu, and he is at teamhealth.com and actually located at Naples Community Hospital at the Baker campus. And he should be logging on any minute, I believe. There he is.
Yes.
Hi, Dr. Conklu. Welcome to the show.
Hi. Thank you for having me. Hi, Liz. Hi, Louise.
Delighted to have you.
Hi, Emre.
Hi. Good to see everybody.
I'm glad this finally came together. I know Liz has been mentioning your name has come up several times, and I kept saying we got to get him on the show, so it finally worked out. So delighted to have you, Dr. Conklu.
Great. I'm excited to be here today.
Wonderful. So, Dr. Conklu, if you can just share with us a little bit about, your humble beginnings. Where did you go to school, and where was that at?
Well, I'm originally from Michigan. I went to University of Michigan, Ann Arbor for undergrad. I did a master's degree at Wayne State in medical sciences. And then after that, I moved down to Florida for medical school. I went to Nova Southeastern.
Nice.
In the Davie area. And after that, I did my residency back in Michigan at Henry Ford Hospital in Macomb. And then after that, I went to Naples to work in emergency medicine at NCH.
Interesting. What made you want to become an ER doctor?
Emergency medicine from the beginning excited me because you really have to rapidly diagnose the patient. You really don't have much time,
Right.
and I like the pressure under 2-3 hours. You have to really figure out what's going on with the patient, and then move them on to appropriate care. And so to me, it's very satisfying to fix the problems in a rapid manner, and I really enjoy it.
It sounds like you work well under pressure, and that's a good thing, right? It sounds like, like you said, you had a certain amount of time to, figure out what to do for them. And I'm happy to know, Liz, there's doctors that can work well under pressure, because if I ever go to the ER, God forbid, I would want to know that I have a doctor that's happy to think on his feet and work well under pressure. Right? Would you agree?
Yeah, Emre can definitely think on his feet.
That's great. And so if you want to share with us, what would you say, I'm curious to know, what would you say are some of the common cases that you notice that people are coming in for? Are there any common cases, or is it everything is random, or how does that work?
Well, in the ER, the majority of the cases that we see that are common are kidney stones. That's a very
Really?
Yes, that is a very common problem. Also, gallstones, abdominal complaints, acute heart attacks, stroke,
Right.
and environmental problems, slip and falls. We see a lot of lacerations. We also do minor procedures like putting catheters, central lines, lumbar punctures where we do spinal taps to rule out meningitis and other ailments.
I see.
So, yeah, those are some of the common complaints.
So, as far as kidney stones and other acute cases, is there anything that we can do? Because it sounds like it would be a sudden, painful like attack. Is there anything that we can do to kind of live a healthy lifestyle so that we can prevent these types of, kidney stones or gallstones? Is there any type of maybe preventative measures to avoid that?
Yes, the most common preventative measures you can do to prevent kidney stones is to drink plenty of liquids, especially just water. Especially in Florida, where it's hot and humid and you're sweating and losing water, you need to replenish the water quickly. And over time, the kidney stones can develop. So, number one is hydration. Two is diet. Without getting into too many specifics, certain types of diet, like too much protein, certain types of proteins can build certain stones. And then the other 1/3 of the cases is probably just genetics, bad genetics. Some people are just more prone to it,
Right.
and there's nothing you can do to really stop it. But the one thing you could do is just try to stay hydrated.
Right. You know what I'm curious about, Liz? I'm always curious about what are like the latest what's the latest technology there would be for such treatments? Like, is there any type of laser, or are there any type of new technology that would help to disintegrate those stones? Or how is that procedure accomplished to get rid of those stones?
Well, in terms of technology, there are some modalities that the urologists use. In the ER, we don't really use them.
Oh, true.
We just treat the pain
Right.
and diagnose it with a CAT scan to confirm that there is a stone. So once we have the diagnosis, 60% of them based on size, let's say it's less than 5 millimeters, those will pass by themselves without any problem. The bigger the stones and the longer that they stay, then we refer those to urologists, and then they use lithotripsy. They can crush the stones, and if they can't get them, they can. If that doesn't work, then they can actually go up into the ureter and get the stone. But that's a whole different field.
Yeah, that sounds painful.
So, one thing you mentioned was drinking more water. And in South Florida in the summer, we are all drinking a lot of water. And one thing I've heard is to put salt in your water or drink a electrolyte water. And I looked at the packaging, and one of them had like 500 milligrams of sodium. So do you think that we here in South Florida, especially if you're exercising or biking, should be putting the electrolytes or salt into our water when we drink it?
Good question.
I don't think it'll. Yeah, that's a great question. I don't think it'll hurt. If you add electrolytes to your water. By adding the electrolytes, that's more for your muscles, and because the whole system needs sodium, and sodium is needed for proper functioning physiology of the body and muscles and everything. So when you sweat a lot, you're going to lose salt. So that's where, adding salt and electrolytes comes into play when you're exercising. So, I mean, personally, myself, I don't really drink too many electrolytes. I don't drink Gatorade. I just stick to plain water, natural sources. But
Right.
I think if you add some electrolytes, it won't hurt.
Interesting.
Yeah, it is interesting. I had a question for you because I've heard, and please tell us if this is true or not. Maybe you heard this, Liz. When there's a full moon, there is a lot more like cases in the ER or even women giving birth during a full moon. Is this an old wives' tale, or is this really something that is true? Have you noticed an incidence of an increase of people being admitted in the ER during a full moon?
That is a fascinating topic. I really don't think there is any science behind it, to be honest. But my observations, yeah, it does seem like some days when there's a full moon, the ER does get busy, and we have more behavioral problems, I would say.
Not
More behavioral
surprised.
problems.
Right.
Yeah. So yes, I do. I have noticed it, and it is definitely possible. But
Yeah.
I just don't. I don't know if the science really can back it.
Sure. I was just curious if it were maybe if you noticed that. Go ahead.
So I know that you are licensed in Michigan as well as Florida. And I was just wondering, what are some of the differences in the cases that you see in the emergency room in Michigan versus Florida?
They're very much similar. However, in Michigan, I would see more cases, more industrial accidents because you have the big
Interesting.
auto up here, lots of factories.
Right.
We would see patients get their hands caught in
Yeah.
machines, and you'd have a lot of cases like that. More falls, more trauma, I would think. In Florida, there's a larger geriatric population, so a lot of the emergency medicine is geriatric focused. So this population are on a lot of medications like blood thinners, antihypertensives. So we see more of those type of cases. And also in Florida, we will see more bites like snake bites, alligator bites. We had a case in Naples a few years back where somebody actually lost their hand,
Oh.
and from an alligator.
Wow.
So
Wow.
Wow.
yeah, you will see more environmental cases in Florida.
Yeah, I imagine.
Interesting.
So, Dr. Conklu, what are some of your interests? I know you mentioned, I think you had mentioned in your email or something or text that you had some research interests. Can you share with us maybe some of those interests that you have?
Yes, I'm not actively in any type of research right now, but I did a little research in college with brain neurons, and at that time we were trying to discover the effects of insulin on neurons when the neuron basically is dying. So that's called when the brain loses oxygen, it's called brain anoxia or anoxic injury to the brain. So
Yeah.
that's not good. So when you have a stroke or a heart attack
Sure.
and you lose oxygen to the organs, you basically have 3 or 4 minutes left before damage is done to the neurons. And the neurons are the first cells to go.
I have a quick
Meaning-
commercial break, Dr. Conklu. We're going to continue back because I'm loving this conversation about the brain, but we'll be right back. Quick commercial break.
Okay.
Thanks. All right.
We'll be right back.
Be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you so much for returning back to our show, You and Your Doctor, sponsored by All County Healthcare. And we are having a delightful conversation with Dr. Emre Conklu. I am with my co-host today, Liz. And we are and we are interviewing Dr. Emre Conklu. He is at teamhealth.com, and you can reach him at 239-436-5000. Thanks for coming back to the show, Dr. Conklu.
Thank you. Can you hear me?
Yeah, we hear you great,
Yes.
loud and clear. So I'm loving this conversation about brain cells, because I always wanted to know, can brain cells be regenerated? Because we've heard in the past, oh no, once they die, they're
interesting.
gone. Can you let
Good
us?
question.
Yeah, I'm very
Good question.
curious. Want to know if all my brain cells that have died, if I can have any type of renewal.
Well, yeah, it depends on the injury.
Oh,
So,
interesting.
so once you lose oxygen to the brain and the neurons, they begin a cascade, a very complicated cellular mechanism where the cells begin to slowly die off.
Oh,
And that starts after about 4 minutes of lack of oxygen.
right.
Regenerating the neurons, that's a huge research topic right now, but right now we cannot regenerate neurons. Once they die, they're basically gone.
Okay.
So the whole goal is to prevent that, and
Yeah.
the neuron, once it's on that cascade, it's very difficult to reverse. That's why we learn basic life support, and
Yes.
time is of the essence. When you have a heart attack and the heart stops,
Right.
you basically just have minutes to restart it.
Now, I heard, Liz, I was interviewing another doctor, and he was mentioning when someone has a stroke, how critical it is to get them into the ER ASAP, because you do have a certain type of medication that you would give them right away to help fight off any further, I guess, complications. Yeah.
Interesting.
Yes.
Can you share with us about your stroke people that come in? What would you do for them? What's the protocol?
Sure. So an ischemic stroke is when you have a clot in the brain, in the artery, and you have a compromise of blood flow to a certain portion of the brain. And so we can use medication such as TPA, which is a clot buster.
Okay.
And so we can basically disintegrate the clot if it's given within a certain amount of time. However, now the neurosurgeons, interventionalists, interventional radiologists can now go in and they using similar to a cardiac cath, they can go into the arteries of the brain. And,
Really?
yes, and they can actually go in and remove the clot.
Oh, wow. I don't think I knew that. That's
Wow.
interesting. That's
Interesting.
Yeah. That helps a lot of people from further damage and complications, I would imagine.
Yes, yes, especially if it's caught in time. So
So in the ER, is that something that you would do, or do you have specialists that come in? Do they come into the ER to do that, or you send them out?
well, if somebody presents with a stroke, we would send them for a CAT scan
Right.
and imaging studies first. And then once we have that diagnosis, the patient would immediately go to a suite where the other teams can go in and take care of the patient. We don't
I
actually
see.
do any procedure like that in the ER unless we're in a remote area and we cannot send them to the operating room or to the suite. If we're in a remote area, our other option is just TPA, which is that clot busting drug. So, but most stroke centers do have the capabilities of treating them in the hospital.
Interesting.
Wow.
So, yeah, what other type of unusual or maybe interesting cases have you experienced as an ER doctor? I'm sure it's so random, right? What are some of the other maybe cases that you wanted to share with us?
Well, we see all types of trauma and for example, car accidents, gunshot wounds.
Oh,
Luckily, those
yeah.
are rare, and the cars now have a lot of airbags and a lot of technology to prevent a lot of these fatalities. So up to about 50, 55 miles per hour for car accidents.
Wow.
You're pretty much safe as long as the car doesn't flip over and roll over. But a lot of the fatalities we see with car accidents are when they exceed high speeds, 70, 80, 90 miles an hour. That's when a lot of the fatalities happen with direct impact, with other cars or if they go off the road and hit barriers. We have seen gunshot wounds and treated, gunshot wounds, and amazingly, a lot of people do survive.
That's good.
I had one case where he was shot in the scalp, and luckily the bullet did not enter the cranium in the brain, so he survived.
That's a miracle. That is
Yeah.
a miracle.
Right. So we see a lot of different cases with trauma. And so,
Emre, Dr. Conklu, where did you do your residency? Wasn't it in Michigan?
yes, at Henry Ford.
Yeah, I remember you saying when you were in your residency that in the ER there was a lot of gunshot victims. You saw a lot of mental health issues there in that hospital. So it must be very different in Naples where you currently practice. And do you miss the excitement of Detroit and the cases you saw in Detroit?
Honestly, it's very similar. It's not much different. You would think it is much different. It's not. The cases are very similar. Maybe in Detroit you would see, like I said, some maybe a few more gunshot wounds or industrial accidents, but the cases really are very similar. And
Interesting.
Interesting.
I enjoy working in both states. They were both very challenging, but
You have the best of both worlds.
Right.
Yeah.
What is a typical schedule? How long is your, what are your hours like? Your
The
schedule?
Yeah, the hours are variable. Typically, they're 12 hours from 7 a.m. to 7 p.m.
Okay.
But you do also have shorter shifts. So sometimes they're 7 a.m. to 3 p.m., sometimes 12 p.m. to 10. And then obviously there's the night shifts. But usually the average is about 10 hours.
Nice. Dr. Conklu, we actually have 1 minute left. This has gone by so quickly. Would you like to leave the audience with, I don't know, you can leave us with whatever advice or whatever you would like to share with us in this one last minute that you have?
Sure. I would say with lacerations,
Yes.
simple lacerations, when you cut your finger at home,
Yeah.
usually you have about 12 hours. Don't wait. A lot of people, they'll wait 24 hours to come in. By then it's too late to fix your finger. So if you have a cut on your hand or anywhere on the body, you have basically 12 hours to get that fixed.
That's good
Yeah.
information.
Good information.
Very
So
good.
take action right away,
Yes.
everybody out there. Thank you so much for joining us today, Dr. Conklu. It was such a pleasure meeting you. And we thank you for taking time out of your busy schedule to talk with us here today at our show, You and Your Doctor.
Yes, thank you,
Oh.
Dr. Conklu.
Thank you very much for having me on. It was my pleasure.
Absolutely. Very informative. Thanks for joining us today, Liz.
Yes, I had fun. Thank you for inviting me.
Okay. We'll see everybody next week for another episode of You and Your Doctor. Take care.